Hopefully you've had the chance to follow Kent Family Medical's FeNO Diaries video series, where we explored their journey introducing the NObreath FeNO device into everyday practice. Today, I'm joined by Dr. Rebecca Prince to reflect on how the past year with the device has enhanced asthma care in the clinic, from implementation to patient outcomes. Thank you for joining us today, Dr. Prince. So looking back on the past year, how easy was it to integrate FeNO testing into your clinic's workflow?
It's been really easy, it's been great. So we started off quite slowly. We made sure that I'd had the training, the rest of the team had had the training, and then we just started using it in appointments where somebody might be presenting with cough or respiratory symptoms, but probably not asthma or low clinical suspicion for asthma. But it was a nice thing to just use in addition to more evidence to rule it out. So we just started like that, and then we kind of gradually increased things, and as our nurse got up to speed, we started doing asthma diagnostic clinics, which has been really helpful. And now we've developed some asthma packages for people with pre-existing diagnoses of asthma. So we're using FeNO at their regular checkups and to monitor FeNO where we've changed inhalers and things like that. So kind of starting quite small and then gradually built it up. So
amazing.
Good.
So how has FeNO testing changed the way you assess and manage patients with asthma?
It's changed things quite a lot. I think the first thing is it's made it a lot easier, and it's great for us to be able to do kind of a quick near-patient test in the clinic, but it's great for patients as well. You know, they don't necessarily have to come out to the reception and book another appointment and wait a week or two or however long. It's so quick and easy to use, so we can use it in the clinic. I think if somebody's symptoms are very strongly suggestive of asthma and they've got a high FeNO, there's been occasions where we can safely diagnose them with asthma there and then. So it's been really helpful. And also it's changed the way we monitor asthma. So it's been helpful, particularly in those patients who have other conditions as well. So if they have, a heart condition that's contributing to breathlessness, but also asthma, and it's a bit difficult to pull apart what's causing the shortness of breath, and we're escalating the inhalers, we can kind of say, oh, okay, we've increased your inhalers, and we can see that your FeNO is controlled now. So kind of, I'm happy that we've managed the asthma side of things. Let's move on to this. So it's just
amazing.
Quick, easy, quite an objective measure. So it's changed things quite a bit.
That's really good. You've probably touched on this, but have you found it helpful in confirming diagnosis or guiding treatment decisions? You touched on that.
Yeah, no, it has been good. And now we kind of have a really nice setup where somebody will have an appointment with a GP at the clinic. We can talk about how high our index of suspicion is clinically for asthma, do a FeNO test in that appointment, and then make a decision as per the new joint respiratory guidelines. Do we then go on and take a full blood count to check eosinophils? If that's normal and FeNO is normal at that point, only at that point would we book them in for spirometry. So it's been good to do it kind of in a stepwise manner, but as I said before, get some answers there and then. And also, helping manage people's asthma. That's been quite a game changer. And I think things that patients like, it's quite empowering to know, okay, I'm aiming for my FeNO to be this number. Okay, let's change my inhalers. Let's check it again. Okay, we're not quite there. So very useful.
Amazing. How have your patients responded to FeNO testing? Do they find it useful or reassuring? Again, you've just touched on that.
Yeah, no, they do. I think, like we said, they seem to really like the fact that it's very quick, simple test. It's been brilliant with children in particular. So people of all ages have loved that we can do it there and then. It doesn't take very long. The device is very visual and it's quite fun to do, really. So especially for children, it's certainly not a scary test. It's quite a fun thing to come and do at the doctor's. So they found it, really helpful and very reassuring as well.
Really good. Have you seen any improvements in clinical efficiency or outcomes since using the NObreath?
Yeah, definitely. And I think probably for lots of different reasons in different circumstances. So again, that speed of diagnosis has been very helpful. So people who, are a new diagnosis of asthma, have really strong symptoms, we can diagnose them there and then and start effective treatment. So obviously that has better outcomes, sooner relief of patient symptoms. So that's been really helpful. And then I think the pathways that we've spoken about, being able to monitor patients FeNO when we're changing inhalers and inhaler dose, looking at even inhaler technique or compliance, or, you know, hang on a minute, we're giving you a decent dose of steroid, this isn't actually lowering your FeNO. Is that because you've got ongoing airway inflammation? Or do we need to support a little bit here with the inhaler technique, and maybe we're not getting it quite right? So it's been brilliant.
Looking back on your experience so far, what has stood out the most about using FeNO?
Just how easy it is, I think. I think historically, kind of in my NHS practice, some years ago when FeNO was first introduced, we had a device which I kind of gave up using in the end, and would book a patient in at a later date to have a FeNO test, because I'd try and do it there and then, but I couldn't get it to kind of be a correct reading. It was often kind of blowing too hard or not hot enough, and then would take a while to reset. So I think just how easy it is has been amazing. Just a really simple test.
Brilliant. Would you recommend FeNO testing to other private clinics or general practice?
Definitely, I'd recommend it to everybody. I think, especially with the new joint guidelines, it's nice to know that we're following those nice BTS sign guidelines, and using the new technology to make sure our treatment and our care of patients is up to date, but also it's such an easy, simple thing to implement.
What would you say to other practices that are considering adopting FeNO testing?
I'd say it's really important. It's always important that we're practicing evidence-based medicine, and that we're offering our patients tests that are recommended in national guidance. So I think we have to do that clinically for that reason. But also, as I said before, it's such an easy thing to do that it is a relatively simple way of making sure you're providing best practice.
Amazing. Well, thank you very much, Dr. Prince, for sharing your insights and your experience with the NObreath FeNO device. Thank you.
Thank you.